good afternoon. My name is Ali Kincaid. I am the manager of Cabinet Communications here. Thank you for joining us this afternoon for this media briefing regarding the current COVID-19 outbreak situation in the Northwest Territories. Just a quick note before we get started with remarks from our speakers. I kindly ask that all media members and participants mute their microphones until you're called upon to limit any potential feedback or background noise. Speaking this afternoon, we have Premier Carolyn Cochrane, Health and Social Services Minister Julie Green, Minister of Municipal and Community Affairs Shane Thomson, and Chief Public Health Officer Dr. Kandola. Also joining us is Territorial Medical Director Dr. AnneMarie Pegg. As per usual, following their remarks, we will open the floor to questions. I will run through each outlet one at a time, so you will all have the opportunity to ask a question as well as a follow-up question. When you ask your question, please provide the name of the person to whom you wish to direct the question, if you have someone specific in mind. Otherwise, I will help to determine who the question should be directed to. With that, I will turn it over to Premier Cochrane.
Thank you, Ali, and good afternoon, everyone, and thanks for joining us again today. I want to start off with a message for the family and friends of the resident who passed away as a result of COVID-19. The government of the Northwest Territories offers our sincerest condolences for your loss, and we're all thinking about you during this difficult time. Our hearts go out to you as you grieve. As of today, there's a total of 227 cases in the Northwest Territories in 9 communities. We have reported new cases of COVID-19 regularly since the outbreak began 10 days ago. However, over the last few days, we've seen the number of daily new cases decrease as our teams on the ground work hard to contain the spread of this virus. This is welcome news. The efforts of community members, Indigenous leaders, community governments, and our incredible team of healthcare professionals has helped us to manage this outbreak. We have deployed resources to the affected communities to support efforts designed to limit the spread of the virus and to support the needs of community governments, Indigenous leadership, and their residents. While we remain cautiously optimistic things will continue to improve, it's important that we all remain diligent in our efforts. We still have a lot of work to do. Norman Wells was placed under a containment order effective this morning at 8 a.m. and we continue to see regular updates to the public exposure list. As we know, our situation in the N.W.T can change very quickly, and now is not the time to let up on protecting the health and well-being of our communities. Please, everyone, keep following the public health orders and recommendations. I also want to thank the residents in Colville Lake and Fort Good Hope for following the containment order and doing their part to curb the spread of the virus. I know it's been difficult for you, but you have all come together to support one another during this time. I also want to thank the hundreds of residents who have followed self-isolation requirements across the N.W.T. We have had confirmed cases in other communities as a result of this outbreak, and you've all done your part to limit the spread of the virus. Yesterday, we reached an important milestone. 75% of eligible residents over the age of 18 are now fully vaccinated. When we first began administering vaccines in the final days of 2020, we knew that it would take a lot of work and coordination to get to this number. I couldn't be more prouder of the residents of the territories for getting vaccinated. It's our best defense against the virus. Let's keep going. With the daily new count in southern Canada reflecting what is being described as a 4th wave due to the Delta variant, we are making decisions based on the priority to keep residents and communities healthy and safe. Dr. Kandola will provide an update on emerging wisely monetarily. This outbreak is a stark reminder that we are not immune to an increase in cases, despite all our efforts over the past 18 months to keep our case count low and avoid loss of life. We all must continue to do our part, follow the Chief Public Health Officer's orders and recommendations, and please, if you haven't already, book your appointment and get vaccinated. I'd now like to turn it over to Minister Green. Thank you again.
Thank you very much, Premier, and good afternoon, everyone. I would like to, as the Premier did, begin this afternoon by offering my condolences to the friends, family, and loved ones of the man who died yesterday because of COVID-19. There really are no words that can take away their pain and sadness, and we are thinking about you, and we do grieve with you. I would also like to acknowledge the hard work of our frontline healthcare and emergency response staff, as they've done an incredible job responding to this outbreak. Extraordinary efforts have been made by the dedicated professionals working throughout our healthcare system. Despite staff shortages and countless other challenges, these individuals have stepped up to successfully meet the needs of N.W.T communities and residents. While this current outbreak has certainly put a strain on our resources, the response to date has been swift and effective, and we will continue to deploy resources to communities as needed. We've seen the challenges faced by other jurisdictions during previous waves of COVID-19. We've learned from others and applied these lessons in the development of our own detailed response plans. We are prepared. Our staff are highly skilled and trained, and we can move resources quickly where and when they are needed. Additionally, we will continue to work proactively with our federal partners to secure additional resources as needs are identified. This will ensure we can sustain an effective response and continue to meet the needs of residents, regardless of what the next few days, weeks, or even months may bring. As healthcare workers are deployed across the territory to serve N.W.T residents in these difficult times, we as residents also need to do our part to reduce the spread of the virus and prevent future outbreaks. I believe wholeheartedly that there needs to be a great sense of personal responsibility when it comes to combating COVID-19. Every N.W.T resident must do their part to help keep us all safe. We will get through this together by doing the things that are simple and effective, and things that we know work, like wearing a mask in public, practicing good hygiene, limiting our social circles, and staying home and getting tested if you're feeling unwell. We will get through this together by getting vaccinated. Vaccines are proven safe and are the best way to protect ourselves, our loved ones, and our communities, and especially those who haven't had the chance to be vaccinated, including 7,000 N.W.T children. Thank you for your attention, and I will now turn the microphone over to Minister Thomson.
Thank you, Minister Green. I would like to offer my condolences to the family and loved ones of the respected individual whose life was lost to COVID this past week. This is a difficult time for many communities, and you are in my thoughts as you support each other and pull together to get through this very challenging time. I'd like to make some brief comments about our ongoing emergency response to the current outbreak. The N.W.T is working hard to support and protect communities and residents. The communities impacted by the current outbreak have activated their local emergency management organization, or EMO, and are using their pandemic emergency response plans to guide their work. Communities through the local EMO are the first to respond in situations like this, and I want to acknowledge the amazing work that they are doing on the ground. Local EMOs are supported by N.W.T regional and territorial emergency management organizations, all of which have been activated to provide advice, information, and support, including coordination of the N.W.T assistance. The emergency management organizations are in place to respond to the needs and requests of the communities. They are actively engaged in providing food hampers, cleaning supplies, accommodations, and transportation as needed. The response teams are well prepared to manage the difficult situations and help all affected communities and residents get through these unprecedented unprecedented times. I'd like to thank the Joint Task Force North and the federal government for their support. Presently, we have 9 Rangers deployed, and Joint Task Force North is actively working on contacting additional Rangers to see if they wish to be deployed. Thank you, and I'd like to turn it over to Dr. Tammy Kandola, Chief Public Health Officer of the Northwest Territories.
Good afternoon, everyone. First, I want to acknowledge that N.W.T's experience of the last 10 days has been difficult for many communities. We have lost our first N.W.T resident to COVID-19. All regions of N.W.T have COVID-19 activity. N.W.T is living through community transmission of COVID in some of our communities for the first time in this pandemic. Community transmission means that infections are not limited to just people who traveled or their close contacts or outbreaks in a workplace or school. Community transmission means that COVID-19 transmission is occurring in the general community as people go about their daily lives. Right now, we believe that community transmission has occurred in Fort Good Hope, Colville Lake, and Norman Wells. The situation is also changing for Yellowknife. Yellowknife is also experiencing low numbers of dispersed, locally acquired COVID-19 infections. Some of the exposure sites that you've seen posted in Yellowknife have resulted in transmission. This means we are seeing the very beginning of community transmission in Yellowknife. In order to reduce the risk of transmission, I am issuing a mandatory mask order across the N.W.T for indoor public places, and that will take effect tomorrow at 8 a.m. N.W.T's recent experience in what many places in Canada and globally have experienced much earlier in the pandemic. These last 10 days remind us that N.W.T can never be completely sheltered from COVID-19. The situation in N.W.T is very different in some ways. We do not have the resources that larger centers in cities and towns in the South have. And for some people, this is causing a lot of fear and worry. It is important for everyone to know that there are measures that will help us to take control of the situation. We must all learn to live with COVID-19, and we have been preparing for this. We did know we would see more cases of COVID-19 once travel restrictions have been eased. And we knew it was going to be different. That's due to the high transmissibility of the Delta variant. The Delta variant behaves differently. It is much more transmissible than previous virus variants. We are seeing that people develop COVID infections quickly after their exposures, meaning the incubation period is shorter. This makes testing and tracing much less effective because the circle of transmission from person to person expands quite quickly. Our response will include a number of changes. Effective as of noon today, I have amended the travel order so that people in small communities or those working with vulnerable populations or high-risk settings, when they enter into N.W.T, they will be required to complete their exit test earlier on day 8 instead of day 14. Symptom checks will only be required on day 2 and 6 for people self-isolating and people self-monitoring. Both of these changes will help catch positive cases earlier and assist with containment. I know that the direction is shifting, and that's because the virus is shifting too. My office and team, along with countless other frontline workers, have been working as hard as we can, focusing our efforts on contact tracing, testing, and delivering vaccinations. With the Emerging Wisely plan, I have maintained that the final decision about easing restriction will be made using all the best information and data available to me at the time that each milestone goal is reached. Based on our current situation of community transmission in multiple N.W.T communities, I have made the decision and recommendation that our N.W.T borders will remain closed to leisure travelers. Now is not the time to be increasing the risk of importation of the COVID-19 virus. There will be no amendment of the orders related to leisure travel in the N.W.T until further notice. And we will continue to monitor the COVID-19 situation and relax measures under emerging wisely when it is safe to do so. The containment order for Colville Lake and Fort Good Hope have been extended. The communities of Fort Good Hope and Colville Lake have done their best to prevent ongoing transmission. The risk of further transmission remains high, and the restrictions that are currently in place in these communities will apply for another 10 days. People who have had COVID-19 have recovered are no longer contagious, so these individuals no longer need to self-isolate once their healthcare provider have deemed them has recovered. And we have introduced a new containment order in Norman Wells. We have new exposures in Norman Wells, and infection numbers are increasing. Initially, I provided a recommendation to not gather. A public health order means that this is not just a recommendation any longer. We need to protect people from COVID-19 in Norman Wells, and these include the children who are due to get back to school soon. The previous recommendations had not been effective, and we are seeing ongoing community transmission, and we're seeing a significant rise in cases. So we do know the current COVID-19 situation in N.W.T is difficult, and we know many people are scared. Most people who develop COVID-19 will recover and be okay. Many will not get sick at all. Some remain at risk for severe outcomes. And vaccines do prevent infections, and vaccines do prevent severe outcomes. And as we ease restrictions further in the future, we need to live with COVID-19 in our territory. Before closing, the one thing I am pleading with all residents to do right now is to take care of the children under 12. This age group are the most susceptible to getting a COVID-19 infection because they're not eligible for vaccines yet. They need to isolate if they have traveled out of territory. They need to stay home from school if they're even a little bit sick to make sure COVID-19 does not enter into the classrooms. And we all need to do the following. Wear a mask in indoor public spaces. This is the best thing you can do to take control over your own safety and to help keep others safe. If you are an employer, revisit your exposure control plans. And this is required under N.W.T workplace safety legislation. Place barriers between your staff and clients and have staff wear the appropriate PPE. In addition to masking, this may include eye protection such as face shields or eye goggles, and the employer is the best person to make this determination. Physically distance when you can, keep on washing your hands and surfaces, and most important, stay home when you are sick. Arrange for testing when you are sick. And we will continue to provide further updates on N.W.T situation response. But please stay safe and support each other, and we will navigate this challenging time in the next few months. Thank you.
Thank you, Dr. Kandola. With that, I am going to begin the question and answer portion of our briefing. I would ask again that you will mute your mics until you're called upon. I have noted that there are some media outlets with more than one representative present. So in this case, I will call upon the outlet rather than the individual reporters, and I will leave it to you to determine who will pose the questions between you. So I'm going to turn it over to begin with to Charlotte from APTN. Charlotte, go ahead. Charlotte, are you still on the line? Is there another reporter from APTN with us? Okay, I'll move along to Sarah Sibley from Cabin Radio.
Perfect. Thank you all for meeting with us today to provide some more information and clarifications. My first question, I believe, is for Dr. Pegg. I'm curious to know, have over the past 10 days, has the N.W.T had the capacity to keep up with all of the testing needs through all of the outbreaks in the communities and things like that? And if not, what's slipping through the cracks right now?
Okay, I believe I'll direct that to Dr. Pegg.
Yes, thank you for that question. Just want to make sure that you can hear me. I'm having some technical issues.
Yes, I can hear you.
Okay, perfect. Thank you. So I'm very, very proud to say that despite the huge volume of testing and contact tracing that's had to go on, the staff are doing an excellent job keeping up. We have implemented in some situations a prioritization of testing to ensure that those people who are the most likely to be infected and furthermore the most likely to become severely ill get tested in priority. But we have been able to keep up with the testing for people who have been named in various public exposure notices and those who've been instructed to isolate and seek testing. So in some cases, there have been delays of a couple of days before people are able to access a test. That's not necessarily a capacity issue, that's a prioritization issue to make sure that we are actively seeking out people who are at the highest risk for being either infected and most importantly, for being infected with the severe form of the disease.
Thank you, Dr. Pegg. Sarah, do you have a follow-up question?
Yes, please. I believe this will be for Minister Green or Dr. Kandola. There are some people who are experiencing homelessness who are currently self-isolating in Yellowknife, I believe. Can you speak to how widespread COVID is within that population and how concerned you are about this?
Go ahead, Minister Green.
Yeah, thank you. I can't give you a figure for the status of homeless people in particular and their infection rate. I can tell you there are 70 people who are in an isolation center where they are receiving clinical support, including testing and vaccination opportunities from the NTHSSA. So there is isolation going on, but I can't confirm infections specific to this population or any population because it is a privacy issue when you get down to a group of only 70 people. Thank you.
Thank you, Minister Green. Moving on, I'm going to ask CBC. I know we have a few reporters from CBC. So CBC, do you have a question?
I do. So this is AnneMarie, and again, thank you everyone for having us today. This question is for Dr. Kandola. So for the last year and a half, we've been dealing with COVID-19. So why is it that only now the territory is deciding to make masks mandatory? Thank you.
Go ahead, Dr. Kandola.
Thank you. So we've been fortunate in the last up to this point in the pandemic where we were relying on an importation model. We had several outbreaks, one in Fort Liard, one in NJ McPherson, and there was the other one was a GK mine outbreak, but we were able to quickly contain those outbreaks and not have ensuing spread. What we're seeing for the first time in a pandemic journey is we're seeing community transmission, we're seeing widespread exposure. If you look on our website, we see a number of exposure sites, and we also have a change in the pandemic. It's now being led mainly by the Delta variant. Delta variant is highly infectious, short incubation period. By the time we know that someone is positive, they've already have been at locations and have exposed quite a few other people. We feel at this time that the vaccine is one solution, but it's not the only solution. You need to have a layered public health approach if we're going to bring this under control. And we want get to the point where we can actually offer children, particularly those 5 to 11, to be vaccinated and have better population coverage. But at this moment, we're experiencing community transmission, we're experiencing ongoing exposure notifications, and we're experiencing a 4th wave. And schools are going to be opening up next week for the majority of people in N.W.T. So that introduces another exposure risk. Masking and mandatory masking will help mitigate and slow the spread. It will buy us some time so we can get vaccines available for the 5 to 11-year-old population.
Thank you, Dr. Kandola. Anna, did you have a follow-up question?
I do, yes. This is also for Dr. Kandola. So you mentioned earlier in the press conference that we're starting to see some hints of community spread in Yellowknife. How long do you think that it will take to issue similar restrictions like have been issued in Fort Good Hope, Colville Lake, and Norman Wells? And is the territory planning to do that anytime soon? Thank you.
Go ahead, Dr. Kandola.
So with Colville Lake and Fort Good Hope, when we first started to discover the cases, the exposure had been widespread, and pretty much we considered in the communities, all community members exposed. We needed to issue a containment order and to bring the outbreak under control, and it has come down significantly. Thing with Norman Wells, it initially started as an importation model and then early community transmission, but with the wastewater signals and with what we're hearing around potentially breaches in compliance, it's got a significant higher exposure risk, and so we had to do the containment order to bring it under control. With Yellowknife, with having the mandatory masking, aggressively contact tracing and having the cases isolate, we feel we can bring it under control without any additional restrictions. There are 3 messages that I do want to bring home to everyone in N.W.T. that will bring it under control for everyone. Is 1, if you are able to get vaccinated, get vaccinated. 2, wear a mask in indoor public spaces. And 3, if you're sick, please stay home. Those are the 3 main messages. We don't know which community the COVID is going to show up next, but we do know is that our travel had tripled to even quadrupled since the beginning of June. And when that happens, we have an increase in importation risk.
Thank you, Dr. Kandola. Next, I'm going to go, I know that I offered to CKLB earlier. I see Luke Carroll on the line. Luke, do you have a question?
Yeah, I do. This is for Dr. Pegg, I believe. So what is our hospital capacity for COVID patients, and how many are currently hospitalized as of today?
So I can confirm that we have less than 5 hospitalizations. We are not releasing exact numbers of hospitalizations when they're low for reasons of patient confidentiality due to the small numbers of people who are affected by this. Our current hospital capacity is adequate for the number of patients that we have. We do not have anybody hospitalized in ICU at the moment, and we are working to ensure that our resource deployment is such that we can pivot as necessary if numbers of admissions increase.
Thank you, Dr. Pegg. Luke, do you have a follow-up question?
Yeah, I'm not sure who this would be for, but so the exposure notifications in Fort Good Hope go all the way back to August 5th, but the first public notice wasn't released until midnight on August 14th. I'm just wondering why it took so long for the cases to be identified, if there's issues with testing capability in communities. Yeah, I'm just wondering what took so long for it to be caught. Thank you.
I believe that question will go to Dr. Kandola.
So similar to NJ McPherson, over the summer, people were enjoying their gatherings, were enjoying the outdoors. the sense that COVID could reach their communities when they haven't done so before was not something people were thinking about. The initial positive case was picked up incidentally, and once that was picked up, then people who are symptomatic came forward to get tested, and literally within 24 to 48 hours, our cases doubled. Not because there were new cases, but there were some of them were existing cases, and it suddenly occurred that COVID had entered that For Good Hope community. We put out a public exposure notice because through a diligent exposure timelines, we ascertained that there was someone that was symptomatic and that had COVID, that had introduced the virus in the beginning of the hand games. So we were able to get a timeline. Once we did that, more and more people came forward, and we had more and more positives. So it's a matter of, similar to what we saw in NJ McPherson, sometimes people may have minor symptoms and may dismiss the symptoms and may not connect that it could be COVID. But once that connection was made, people came forward readily. And that's why you saw that increase in cases. Those were existing cases. And then in addition, those cases had their own contacts that became cases subsequently.
Thank you, Dr. Kandola. Next, I'm going to move to Thomas from Medias Tenua.
Yes, hello, thanks. So first of all, I believe this question would be for Dr. Kandola. Will there be a mandatory testing or even isolation for fully vaccinated residents coming back from another province, let's say Alberta or territory?
So what we have in place right now, if you're fully vaccinated, you are exempt from isolation. But if you are fully vaccinated and are returning to a small community, you need a day 1 test. And now it's a day 8 test. And you have mandatory masking. For anyone who's fully vaccinated, working in a high-risk setting or vulnerable populations such as healthcare, correction facilities, long-term care, shelters, working with kids under 12, we are also asking that you get a day 1 and day 8 test. For partially vaccinated, we are asking you to isolate until day 8, and then if you're unvaccinated, it's till day 10. And then there's special orders for mixed households. The mandatory masking is an additional layer. We are getting importation of cases, and we're picking them up, and they're coming because our rate of travel has significantly increased, as well as the daily case count for 4th wave has gone up. So we're expecting to see more cases, but we also have community transmission and internal exposures. There are exposure sites where people who may not have traveled are now incubating the Delta variant. So the layer of protection goes back to the 3 messages. If people can follow just these basic 3 messages, is get vaccinated if you can, because what we see is a significant reduction in that population in getting COVID infections. In fact, we have that on our dashboard. We're looking at 22% of our cases were fully vaccinated versus close to 80% that were not fully vaccinated, and the majority were unvaccinated, had no doses. Second thing is, important thing, one thing that we're seeing is that people who are symptomatic are going to events, are exposing others. And it's really important that if you're sick that you stay home, you get tested so you can prevent further exposure. And then the third, which is now mandatory, is the wearing of the mask in indoor public spaces. Other measures are also important, such as the physical distancing, washing hands, and cleaning environmental surfaces, keeping your gatherings small. But those are not a mandatory, such as the masking is mandatory.
Thank you, Dr. Kandola. Thomas, do you have another question?
Yes, I would have a second one, and thank you, Dr. Kandola. I was wondering also if it's possible to have more details concerning the exposure at Katlo-Diche First Nation.
Dr. Kandola, do you have an answer for that one? I believe you're on mute, Dr. Kandola.
I'm sorry. When we have an exposure, where we know we can trace all the contacts and we can identify the contacts and isolate them. We don't release exposure notification. But when you have an exposure such as someone went to a grocery store or a retail store or an event that we don't know who the contacts are, we release an exposure notification.
Thank you, Dr. Kandola, and thank you, Tomas. Next, we will go to Mario from Radio Canada.
Hi, thank you for this. My question is probably for Minister Green, but anybody who's interested in talking about this, I'd be happy. You mentioned, Minister, earlier this week that you were hoping for more help from the federal government, more than the Red Cross and the Rangers that we have deployed to get some more nurses, for example. I'll be honest, we're not getting much information when we do request to the federal, so I'm kind of wondering what is specifically or officially the request for the GNWT to the federal at this point?
Go ahead, Minister Green.
Yeah, thanks. We've made requests in a number of different areas in which we think the federal government can help. And that includes, as you know, activating the Rangers and also having Red Cross nurses and other personnel join us, and then potentially being a broker for staff in other jurisdictions. So this is a sort of an as and when situation that we're calling on these resources. And so for more detail about the resources we've received to date, I'd like to ask Dr. Pegg to provide the details. Thank you.
Sure. Dr. Pegg?
Thank you, Minister Green. I'm not actually able to comment on the status of the federal request in addition to the Rangers and the fact that we have received a field epidemiologist from the Public Health Agency of Canada who has recently arrived and is providing assistance to field teams already. There has been information shared regarding the deployment of Red Cross nurses, some of whom have arrived in Yellowknife already, are undergoing mandatory training and orientation to our systems, and are getting ready to be deployed to whichever area indicates the most need as this evolving situation develops. I also would really like to emphasize, though, that with all of the press time, I suppose, that external resources are getting, is to really highlight the fact that the backbone of this response and the vast majority of the work that's been done in this response has been done by our own staff who are here in the Northwest Territories, who've been incredibly flexible in being redeployed and reorganized. We've called some people back from more administrative and non-frontline positions. And I just really want to emphasize that the external resources are important as we look forward at the potential evolution of this situation, and we want to have those resources pre-positioned, knowing our inherent weaknesses in the system. But certainly that without our own staff that are really stepping up, the external resources are really an adjunct, but not the key component of the response.
Thank you, Dr. Pegg. Mario, do you have a follow-up?
Yeah, I do, and thank you, both Minister and Dr. Pegg. Maybe just to follow up on that, and I do appreciate, I guess, the work that's been done with the resources that we have. So what are we asking? What are the needs that we know will only come from the outside? This question was for Dr. Pegg, yes. Okay.
The needs that are coming from the outside are actually, in addition to the resources that we already have here. They're not different resources, they're additional resources. So we have an incredible team doing testing and contact tracing, but if the case numbers continue to increase, we will need additional people who are able to do contact tracing and testing. We may have a need for additional acute care support, both in our community health centers and in our hospitals, and those are resources that we have already in the system, but we may need to add additional ones. And so the request for external aid that has gone to multiple sources in terms of healthcare resources has really been to augment the capacity that we already have and not to replace any one position or add new positions into the system.
Thank you, Dr. Pegg. That is the end of my list. Is there anyone on the call that is not on my RSVP list here that would like to pose a question? You can raise your hand. Okay, with that, we have about 20 minutes left in the schedule, so I'm going to go back through the list, but I'm going to limit it to one question this time with no follow-up. So I'm going to start again with Sarah Sibley from Cabin Radio. Sarah, do you have another question?
Yes, please. I believe this is for Dr. Kandola. I was just hoping, is there any update on the wastewater signal that was detected in Becheco? Is there any indication of how strong it is or how weak it is, or indicating how many cases there are? I know you can't detect how many cases there are, but is there a magnitude of sorts of how many there may be there?
So we did repeat the wastewater signal because that initial one was the 20, 21, 22nd, and 23rd. And we did repeat the wastewater signal. So it is persistent. So it's still in Becheco. And we've rolled out a rapid response team to do testing and to find the source. It could be a case or cases. We don't know, but we know it is a positive signal and we know it's persistent. And we know there is at least one case in Becheco.
Thank you, Dr. Kandola. Next, I'm going to go to Michelle from CBC.
So actually, this is Anna. I'm asking questions on CBC. No problem.
Right.
So I wanted to know, it's interesting in the press release because there's a mention that people that have already been infected with COVID-19 will be exempt from the containment order. So what challenges does the government foresee with letting people that have recovered from COVID be exempt from the containment order as people continue to be infected?
Dr. Kandola?
So the containment order is for 10 days and we've renewed again for another 10 days. For normal wells, it's the first 10 days. So it's not a persistent containment order. It's a containment order during an outbreak. When we know, most of the cases have been mild, and when the healthcare provider does assessment, and if after 10 days after the onset of symptoms, or 10 days after the positive test, if there's no symptoms, person is recovered, and there's no sign of progression to severe COVID, the healthcare provider would consider that person recovered. Because there are other people still exposed or we don't know what their status is, by allowing that individuals fully recovered, not a risk to anyone else, providing them some means of identification of people could know that the person's fully recovered, that person can then go and help the community. They can go get the groceries. They can help people who are in the household who are already isolated. And so to make an individual isolate when they're no longer at risk of spreading the infection, it doesn't make sense. So we need to be very careful that when someone's covered and no longer infectious, that we're not going to contain with a containment order. And I can ask Dr. Pegg to further elaborate, because this is a situation we've seen in Colville Lake and Fort Good Hope, and they actually end up being helpers of our pandemic response because they can do things that people who are in containment can't do.
Dr. Pegg?
Thank you. Not too much to add, but just to reiterate that people who are no longer infectious, so people who have completed that recovery period, either the 10 days from the onset of their symptoms, or if they were asymptomatic, 10 days from the day that they got their positive test, that they're no longer able to transmit the virus. And so they're no longer contagious and they're not spreading it to people in their community. And as Dr. Kandola mentioned, this is actually a great resource for communities to draw upon in terms of assisting the overall response in the community, being able to support people who are continuing to isolate and being able to provide services and various isolation supports to those in their community who maybe haven't yet completed their isolation period. So really to look at these people as a resource. They're not infectious, and we can do a lot to help integrate them into the recovery efforts of these communities.
Thank you, Dr. Pegg. Next, I'm going to go to Luke from CKLB.
Thank you. Yeah. So a resident in Colville Lake told me there was a vaccine clinic for people who had tested positive to the virus. I was just wondering if that was true and if there are any risks associated with getting the vaccine when you do have COVID. Thank you.
I think that's the question for Dr. Pegg.
Yeah. So people who have recovered from COVID-19 are able to get the vaccine. So similarly to the people who are no longer isolating once they've completed that period, 10 days post symptoms or 10 days post positive test, there is no restriction in their ability to receive the vaccine. So people are not being vaccinated during their active infectious period, but people are certainly being vaccinated and are encouraged to do so once that period is over.
Thank you, Dr. Pegg. Next, back to Thomas from Mediate Noir.
Yes, I would have a quick question. I was just wondering if there's any plans to possibly restrict the travels between regions for non-essential travels.
Going to say Dr. Kandola first, and we'll see if that answers the question.
So the restriction for non-essential travel was made for the SAW2 region during the outbreak, and it's only a recommendation, it's not an order. It allowed the outbreak to peak, and we're at the point where we're looking at who remains that's infectious, and once we feel that there's no risk for ongoing transmission, then we can lift that recommendation. But when you're experiencing an outbreak, you kind of want to limit as many people coming in and out, because we all know it was travel that brought the virus in, and it's the travel that can bring the virus out to other communities. But this has been specific for the SAW2 region. We do have active cases in the other regions, but they've been cluster cases. Specific to Yellowknife, we are starting to see some community transmission. We're hoping with a mandatory masking order and media briefings like this, where we're emphasizing people, if they're sick, stay home, trying to get more people vaccinated, that we won't see a progression to the level of community transmission we've seen in Colville Lake, Fort Good Hope, and now in Norman Wells. But if we are starting to see risks within the community, we can always add the non-essential travel to those specific communities.
Thank you, Dr. Kandola. Premier Cochrane, would you like to address this question on behalf of the N.W.T's current restrictions on non-essential travel?
Thanks, Ellie. I think it's important for all residents of the N.W.T to try to protect each other as much as possible. So following the orders and the recommendations, there is a recommendation around non-essential travel, and the N.W.T has taken the position that all N.W.T employees have been sent a notice and saying that unless it's essential, and essential can be defined depending on the nature of the work that has to be done, then we're not recommending that anyone travel at this time within the N.W.T to be able to help curb the outbreak that we're experiencing. Once the outbreaks are addressed, then we will be re-looking at that again. But that's where we stand at this point. Thanks, Ellie.
Thank you, Premier Cochrane. Next, back to Mario from Radio Canada.
Yes, my question for Dr. Kandola, just I guess to clarify, can we directly link the cases in Yellowknife to the outbreak in the SAW2? I mean, like, is it considered a different outbreak or a cluster, or based on the same line of transmission, or is it two separate events?
Thank you. So what happened first, we initially had the outbreak in Fort Good Hope, and people traveling in and out. And so initially, when we were in Yellowknife, we had cases of people that were exposed during their stay in Fort Good Hope, specifically attended the Hand Games event. But subsequently, when we look at the notifications, the outbreak developed its own exposure and transmission. So in Yellowknife, anyone who attended those games, they're either resolved, or if they were contacts. They never developed COVID and they've moved on. What we're seeing in Yellowknife is now related to transmission from the original cases that came from Fort Good Hope. And in addition, we get an importation pretty much every day. There are people traveling in. So it's not only what happened locally with the SARS-2 outbreak and subsequent transmission, and now in some cases community transmission, such as normal wells. It's also every day, sometimes more than once a day, we are getting positive COVID cases in travelers. So those are happening throughout different regions in N.W.T. Hope that answers your question. Thank you.
Thank you all. I believe we are at 8 minutes to the hour, and without time to go back through everyone again, I think we will conclude things there. I would like to thank you all for joining us today. And if you have any additional questions, please feel free to reach out directly to the press secretary or to the OCPHO for further responses on those. Thank you again, and stay safe, everyone.